PhD student in epidemiology and co-founder of the COVID-19 Canada Open Data Working Group, joining us from Toronto. Jean-Paul, appreciate your time. Thank you for joining us.
Thanks so much for having me.
So it's a big day. Health Canada approving the second vaccine now in this fight against COVID-19, Moderna vaccine. Your first thoughts and reactions?
Oh, it's wonderful news. I mean, we'll be able to see this vaccine get rolled out in a much greater variety of places because of those much more lenient storage and transport requirements. So we're going to see this roll out in long-term care homes, in remote communities, in the territories. And so I think it's really fantastic news.
Let's talk about in greater detail, since you've been also doing a lot of research. You and I have spoken on several occasions before. These two shots, Pfizer and Moderna, are approved. We know that by March next year, over 1 million people will be able to get this vaccine. But the differences between the two and how Moderna coming into the picture actually changes a whole lot.
Yeah, I mean, it's mainly down to logistics in the sense that Pfizer, requires these -70 storage, and Moderna is much easier to transport. So I think that's going to be the main determinant. The other aspect to keep an eye on here is that they're both running trials to test out these vaccines in children. So neither are approved for use in children at this point. And I believe the Pfizer vaccine is including younger children, whereas the Moderna one is only including older children. So I think, assuming that it turns out to be safe and effective in those age groups as well, I think that'll also be something to keep an eye on as we think about vaccinating children.
Jean-Paul, while of course the vaccines are here, it's great news, but we also have to continue to remember what we are dealing with. The virus that is spreading. Ontario, for example, again reporting 2,400 plus cases as of today. On the other hand, there is news of this new variant in the UK, how it's traveled to several other nations outside of UK. Of course, we're watching what's happening in Canada as well. Your thoughts, how important it is for us to continue to remember that vaccine here is great, but there are other things we continue to need to do.
I think it gives us, that end point in sight. It allows us to say that this disease is now a vaccine-preventable disease. And so I think that really changes, really makes our sacrifices that we're making worthwhile and more meaningful. But I don't think that the vaccine rollouts, until they become more widespread, are really going to have too much of an effect on how we have to deal with this virus over the winter, certainly January, February.
And as you're a student of epidemiology, I'd like to understand from you, we know that Ontario is now bracing for this lockdown, in some areas 14 days, most of the provinces looking at 28 days. And this lockdown is really strict. Many are seeing this could be just as what we saw in spring as well, at a time when Ontario is seeing over 2,000 cases a day at a stretch. You think this is going to be effective?
Well, we've seen the whole of province approach being effective in another Canadian jurisdiction. Manitoba in early November put the entire province into its red critical zone, and as a result of that, we saw very sharp drops in people moving around as measured by the Google mobility data, and that actually resulted in Manitoba's numbers, their case numbers going in the downward direction quite consistently since the beginning of December. So I think we have seen this approach being effective in other parts of Canada. And I guess we also have to remember that, what we're calling a lockdown is actually not even quite as strict as what we've seen in a lot of European countries.
That's
where
right.
We're talking about things like, curfews, and you have to have a pass to have the reason why you're going out. And so, it's good to keep things in perspective here.
Yeah, and talking of perspective, there's something I wanted to talk to you about. In the month of April, previously when we had the lockdown, we saw that the maximum number of cases were between 600 to 700 in Ontario when the province went into a lockdown. Here, we're talking about cases, like I said, in 2000 for a stretch for a large number of days, and now we're looking at a lockdown. And that's why I say, how do we draw a comparison of how effective it's going to be? 600 to 700 then, 2,000 cases a day now. What do you think?
Well, I think there's two important things to keep in mind here. The first is that back in March, April, especially in certain places like Ontario, we had very little testing capacity compared to what we had now. And so really it was only the most severe people who were being tested, or people in settings like long-term care or healthcare. And so I think that case numbers back then, we were catching a far smaller percentage of cases compared to what we are now. So it's hard to directly compare those numbers. And the second is Back then, we were in spring, we could go outside all the time. And now we're in winter and people are spending a lot more time inside where the virus spreads much more easily. And so the same strategies that would have worked back then would not necessarily be as effective now just because we have that change in behavior that results from the winter. So it really is more difficult circumstances for controlling the virus.
All right, we'll have to leave it at that for the moment. Jean-Paul Soucy, PhD student in epidemiology and co-founder of the COVID-19 Canada Open Data Working Group. Thank you for joining us.
Thanks so much for having me.
Let's talk about Alberta.